I'm Dr. Doug Fry from the Center for Regenerative Orthopedics, and today we're going to talk about plantar fasciitis or fasciosis, which is a painful problem on people's heels, usually on the bottom of your heel, in this area right here, which is called the medial tubercle, which is the attachment of the plantar fascia, which is a fascia that attaches and promotes the arch in the foot longitudinally. There's an arch cross-sectionally, but there's mainly an arch the length of the foot. The arch is very important in transmitting force without causing damage to the rest of the leg and the body. So when you're standing, people have different conformations of their feet. Some people have a pes cavus, where it's got a lot of curve in here. Some people have a pes planus or flat foot, where they actually have very little curvature there. Usually pes planus is more of a problem. Also, when people walk, they often come down and shift this way. And when they do that, it stretches the ligament that's going from here to here, so it puts extra stress on. That's called overpronation. So that's something we'll look for when we're watching the patient walk down the runway, as it were, and we do a gait analysis. The plantar fascia is running from the calcaneus, and as you can see, inserts into the metatarsal tarsal joints, but it also inserts into the tissue that is just holding the whole bottom of the foot together, the fascial tissue. As you rotate this down, you can see that it's holding a bowstring across the longitudinal arch. Now if we add some muscles, you can see that the foot still has plantar fascia as the bottom portion with all the muscles added. This is the bottom most supportive structure on the foot in terms of the longitudinal arch. If you have pressure here all the time, this is what's going to get inflamed. When you have that wear and tear we keep talking about that goes up, and the repair process hasn't changed fast, such as when I was in medical school and had a vacation and decided I could run, instead of 3 miles a day, I'd just run 10 miles a day. And 3 weeks later I had pain on the bottom of my heel. And the resident came in and said, I think you have plantar fasciitis. And sure enough, right here, I was having a severe pain. One of the things that you see in plantar fasciitis is that when you first step down out of bed, that is almost always the worst pain you can get, because as it's been overnight, the inflammation is built up and swelling has occurred with the inflammation, and the first step out of bed, it usually is hitting the nerves that are most stretched and irritated by the inflammation. So what is going on then is you're trying to reduce tension here. The most important thing is to have a a shoe that fits you. If the shoe fits the arch and is rigid, then you have good support and you're not going to have a problem usually with plantar fasciitis. But once it gets started, even putting a good orthotic in may not be enough. Physical therapy can be helpful to strengthen these little muscles on the bottom of the foot that actually can assist with that arch and strengthen the muscles in here. The intrinsic muscles of the foot can also help to reduce the overpronation. So that can be helpful. Changing the kinetic chain from above. So just because it's on your feet doesn't mean that's the cause underlying of your problem. If you have a crooked angle on your knee and it's making the angle come in abnormally, then you may have pain that's really a problem in the knee as far as mechanics, but you're going to feel it in your heel. We have a lot of options for treatment besides the fact that we will custom fit you with over-the-counter orthotics, which are much less expensive than custom molded, that usually cost $400 to $500 instead of maybe $50 to $60. We found that the custom orthotics generally don't give any better effect than custom fitted over-the-counter orthotics. So we have orthotics that can be helpful. We have physical therapy that can be helpful not only in mobilizing the joints of your foot that may be causing problems, but also in assessing the mechanics from the pelvis down to the foot to make sure that the mechanical dysfunction is not causing more problem. We have night splints that you can use. People do that. People roll their feet on ice a lot. A frozen water bottle or something like that can be very helpful. Stretching that ligament and not overstretching, because that ligament actually is continuous. If you look here, it comes back around the heel and continues up the leg as the Achilles tendon, which goes to the gastrocnemius muscles and the soleus muscles. So the tension in this area here is transmitted across and down to this area. So when you're stretching, you're not so much trying to stretch the plantar ligament or the plantar fascia, you're trying to stretch the gastroc and soleus muscles so that they're not putting more tension on it. So that can be helpful. We have injection therapy. Cortisone injections can take out inflammation, but as we've talked about before, when you take out inflammation and you take away the pain signal, most people do more, so their wear and tear goes up, and cortisone actually suppresses the healing or regenerative part of your cycle that's going to build back up, so you've usually caused a problem. Sometimes you can get away with that if you don't suddenly increase your activity. And then we have regenerative injections, which have been shown in head-to-head studies with cortisone to be much more effective over a long period of time. So if you get an injection of cortisone, you're likely to have good pain relief even within a day or two. But if you get an injection with regenerative treatment, it's going to take a few weeks, and you're going to have to do things to help that heal, just like you would if you had injured your ankle or had a bad sprained ankle. So these are the type of things that we can do. The last thing that is the sort of last ditch effort is to surgically cut the plantar ligament. Personally, I like to think that my patients can avoid that, because that takes away the major support for the arch. It might reduce the tension on the heel on that one area, but it takes away a lot of support out of the foot otherwise and causes other problems. So come on down to the Center for Manual Medicine and give us a call. We'll give you a consultation.